Extreme Networks, since our inception in 1996, have been thought of as a strategic, innovative, forward-thinking company, providing simple, cost-effective solutions to a wide range of thinking customers across the world. We're a mature global organisation with a culture of partnerships with other industry visionaries that are also committed to delivering cost-effective solutions and flexible solutions to our customers as well. As we all know, information matters more when there's a life on the line, so having access to real-time applications at the right time is key for physicians, doctors and nurses, so that they can make the right decision right away. Here at Extreme Networks, we provide solutions that are reliable, flexible and secure, and we help healthcare organisations and life science organisations deliver those applications and that critical information in real time so that they can quickly and effectively treat the patients. Every piece of essential equipment within a healthcare or hospital organisation is either mobile or on wheels. This obviously means that that piece of equipment can move from room to room, from building to building, and in some cases across campuses. Asset tracking allows you to have the visibility to control those pieces of equipment, whether it's the physical hardware, whether it's software through software asset management, or indeed whether it's patients or staff alike. As we all know, the most important asset within a hospital is the staff themselves. Although because of the nature of healthcare we can't guarantee staff safety, that said, patient safety drives outcomes. So knowing where a patient is at all times, being able to control any unauthorised absences, having the right information about the patients and the right medication and test results for patients is key. And so communication and accuracy has become a matter of life and death. Software asset management, or SAM as it's called, is a critical asset, sometimes more important than the technology itself. In healthcare sectors, they will have departments that will source software themselves and deploy it as and when they need. As an example, you could have one business unit with some software that's sat in someone's in-tray or drawer that's never been used, but another business department, normally IT, have bought several different versions of this software and installed it when they needed to. This can be, you first lose the ability to manage that. You could have that software from different vendors, there could be different releases of software, and it becomes costly and complicated to manage. Having control over the assets themselves, being able to track equipment itself, being able to secure the policies, leads to better control over that environment. If you add to that the complexity of having a paper-based inventory, where you're relying on the purchase orders and the receipts and the license versions being correct and everything being in order, then if you lose any of that information and you transfer from paper to e-media at any stage, then you're effectively causing a problem internally because the information that you have is not correct, and that can lead to further problems as well. And on top of that, you've got the regulatory compliance, such as HIPAA, and being able to operate and control all this information within the regulatory compliance, within costs, within budgets as well, is key to any healthcare organisation. A good SAM program can ensure that all workstations within a particular department have the same version of software, the same release, the same code, so that doctors and nurses and medical staff can rely on the information that's in front of them to help them make their decisions and ultimately treat their patients effectively. More often than not now in healthcare, a lot of the medical staff and the medical teams will have portable mobile devices, PCs and tablet PCs, and be able to treat patients at bedside. So they'll have access to medical records, any test results, and they might be doing any e-prescriptions and dealing with the pharmaceutical side of things from bedside too. Having a software asset management system allows the physicians to be able to focus on delivering effective healthcare and not have to worry about the information being correct in front of them, because they could have a reaction between two versions of a particular medication that they're giving the customer, so they have to rely on the information that's in front of them. A lot of management executives in healthcare now are relying on SAM to help them through the process of installing new technology or updating their existing technology as well. I think we all agree information matters most when there's a life on the line, so having access to the right information at the right time allows doctors and nurses and medical staff to make the right decision right away. Extreme networks help these organisations in healthcare and life sciences by providing reliable, flexible, resilient network infrastructures that help them deliver effective patient care.